So today's video about connection or scientific link between senescent cells, aging, and cancer. Okay, let's go. Okay, I will just, okay, so let's go. As always, I recommend you to download the presentation as PDF file from the link in the description. You will get access to these links to learn more about the words that I'm using here, and also you will get access to the source information, make your own research. Please mind, I am not medical professional. I am a doctor of science with PhD in physics and mathematics, and last 5 years I work also in biology. This is my love. I love doing it. And okay, so my opinion is almost always different from medical professionals. So you have to decide to trust me or to trust your physician. So, okay, I give this information, so you make your own research. So, accumulation of senescent or so-called zombie cells is a hallmark of aging. These are cells that have stopped dividing but resist apoptosis, so resist programmed cell death. Crucially, they are not passive. They secrete a potent mix of inflammatory signal, growth factors, and enzymes known as Senescent-Associated Secretory phenotype, or SASP. This SASP creates a state of chronic low-grade inflammation in tissues, and far from being two independent age-related issues, cell senescence and tissue inflammation are directly linked. The accumulation of senescent cells is a primary driver of the inflammatory environment that characterizes process, always often called inflammaging. Pardon. So as you see at this slide, normal cell replication goes like without increase of size and without this pro-inflammatory enzymes and signal molecules, but senescent cells are very, very dangerous. I mean, they are not healthy. They produce this chronic inflammation. So how senescence drives cancer initiation and relapse? The relation between senescent cells and cancer is complex and double-edged. The initial suppression and long-term proportion. In the short term, cellular senescence acts as a tumor-suppressive mechanism by halting the proliferation of damaged or precancerous cells. However, when these cells persist, I mean, senescent cells persist, the chronic SASP and then chronic inflammation create tissue environment that is highly conducive to cancer. The SASP can promote the growth and survival of nearly precancerous cells, stimulate angiogenesis or formation of new blood vessels to feed tumors, and facilitate the invasion or in metastasis of cancer cells. Okay, this you can go to the source information, read it. So it is proven information. So this SASP, this Senescent-Associated Secretory phenotype, this pro-inflammatory molecules, they really drive aging and cancer. Okay, then next slide. This is the Senescent-Associated Secretory phenotype, generates pro-tumorigenic microenvironment by inducing extracellular matrix remodeling and inflammation. So the stiffness of the extracellular matrix increasing, so the migration of immune cells suppressed, and then in such conditions, not only senescent cells survive, but also cancer cells cannot be eliminated by immune cells. Pardon. The therapy-induced dilemmas. Traditional cancer treatment use chemotherapy and radiotherapy. Often it works by forcing cancer cells into senescence. While this initially halt tumor growth, it leads to a sharp therapy-induced increase in senescence, is the number of senescent cells in their pro-tumor and their what they produce is SASP. This explains the tragic paradox. While cancer survivors, often young ones, often experience accelerated aging and higher risk of cancer relapse or secondary cancers. The very treatment of cancer saves their life, but also fuel a new disease. Pardon, something else in my. So again, you see, this cancer survivors, they don't live too long. Even if they are officially cured, they live maybe 5, 10, maximum 20 years, and then the cancer relapse, or they just, because of accelerated aging, they just pass away. Okay, so what is happening? The fibroblasts, which are often getting senescent, they turn to the senescent fibroblast, and then eventually they can turn into cancer cells. What is it? The therapeutic strategies, senolytics and senostatics. Okay, this new understanding points to new novel therapeutic strategies. It is senolytics. These are drugs that selectively eliminate senescent cells. The combination of dasatinib and quercetin has been a pioneering approach shown in clinical trials to reduce senescent cells burden in humans and improve physical function in conditions like idiopathic pulmonary fibrosis, okay, on some tissues. Okay, this really works, but so it is not clinically. There was no clinical trials. There was some small trials, and it was proven that it works for humans. But problem also that senolytics don't work for all senescent cells, only for in some tissues. So what we have, senescent cells, and they with senolytics they are removed. Quercetin is safer than combination of dasatinib and quercetin, but also quercetin don't kill all senescent cells, but only in some tissues. So, but okay, we don't have anything better now. Treatment with ascorbic acid is safe with minimal side effects. What is it? Pardon. Mega doses of oral vitamin C, it is from 2 to 18 grams daily, or even 50 grams daily, as powder can reduce glycolysis in hyperactive cells and enhance apoptosis of senescent cells and cancer cells. But again, mind that we cannot kill all senescent cells with oral vitamin C. It is because we cannot get concentration of vitamin C in our blood high enough to lead to apoptosis of the senescent cells. However, for mega doses, the half-life of vitamin C in the blood only about 30 minutes due to the body rapidly excreting the excess amount. Therefore, it is necessary to take ascorbic acid in small portions and several times a day. So again, if you take smaller portions like from 2 to 3, maybe 5 grams, then you can take this many times during the day, and the vitamin C can stay high concentration in the blood up to 3 hours. So every 3 hours, 3-4 hours, you have to take another mega doses of vitamin C. But also the injections of the vitamin C to your blood is working better, actually. And the mechanism is such that vitamin C go to oxidized to DHA, and DHA blocking the glucose transport to the cancer and senescent cells. And cancer and senescent cells, they rely on the glycolysis, on the use of glucose as a source of energy in cytoplasm of the cells, in difference from normal cells which use mitochondria as a production of energy in mitochondria by oxidation. So pharmacokinetic studies show that intravenous vitamin C administration, this is like sodium ascorbate, and up to 25-75 grams, it is a lot. These interventions may result in much higher, up to 70 times higher concentration in the blood than oral intake, and would be potent anti-cancer agent and adjuvant. It is interesting that prostate cancer patients showed the most benefits from this intravenous vitamin C in the administration, and both oral intake and intravenous administration of vitamin C in megadoses facilitate removal of calcium oxalate crystals from tissues and may increase the risk of kidney stone formation in some individuals. So if you planning or if you're thinking about oral intake of the large doses of vitamin C as sodium ascorbate or ascorbic acid, then please mind that you have to increase these doses over time, not take just large doses. As you have to go to the, otherwise you can get kidney stone formation in some, not always, but in some individuals. Therefore, smaller portions during the day and gradual increase of the doses are recommended. This is what I'm talking about. So this is, again, in some hospitals, if you will bring, they don't have. If you can buy elsewhere and bring this sodium ascorbate solution, it can be infused in your blood. In Bangkok, for example, in Bangkok there are clinics which have all this and they make this treatment. I don't know about the prices, but it is advertised that they can make this intravenous administration of the sodium ascorbate. Okay, so I rely mostly on oral supplementation, but every day, and so I don't think I need it, but some people with cancer may think about this, but again, please mind that if you was not using large doses of ascorbic acid and ascorbates, it can create problem with your kidney. A dual combination of doxycycline and vitamin C was investigated as a new synthetic lethal metabolic strategy for starving and eradicating cancer stem cells and also senescent cells. So a triple combination of doxycycline, azithromycin, and vitamin C was investigated in laboratory cell cultures as senolytics, which selectively kill and remove approximately 90% of senescent fibroblasts. So it was laboratory cell culture. Personally, I use such combination. It works because, again, if you take oral vitamin C or ascorbic acid orally, the concentration is not enough to kill cancer cells and senescent cells. But this combination, triple combination, is for the triple combination, you don't need very high concentration of vitamin C. You just take therapeutic doses of doxycycline, azithromycin, and then it like 200 milligram of doxycycline, azithromycin, also some therapeutic doses, and the vitamin C, few gram, or maybe up to 20 or gram or more during the day, and it works. But again, please mind that not only senescent cells, but other other cells like your heart and liver can be damaged. So please be careful. So vitamin C and doxycycline, this is again they worked in synergistically. They block in energy production in cancer stem cells, and eventually they kill them. And triple combination even better. So when used as single agent, vitamin C can act as pro-oxidant and induce mitochondrial biogenesis, because that if you don't have enough glucose in this hyperactive senescent and cancer cells, they can shift for a while to use of mitochondria to produce energy, and they need more mitochondria, of course, in this case. But triple combination of this antibiotics and vitamin C will block will block the mitochondrial biogenesis, and then it is leading to production of more higher production of reactive oxygen species, and also blocks production of energy in the hyperactive cells, and then it is working such way. But again, mind that it is there were no clinical trials with triple combination, and so be careful in it. Okay, senesstatic. This agent don't kill senescent cell by suppress harmful production of this SASP, effectively that muzzling them. And antioxidant, berberine, quercetin, fisetin, and metformin have senesstatic potential. Yes, because again, senescent cells use glucose as a source of energy. And berberine, fisetin, and metformin, they reduce concentration of glucose in your blood, but also in combination with ketogenic diet or strict carnivore diet also will work. So the evidence suggests that adjunctive therapy with senolytics during or after cancer treatment can reduce side effects, prevent cancer relapse, and extend the healthy lifespan of patient. Better, of course, avoid the development of cancer, just taking on regular basis this megadoses of ascorbic acid, for example, together with berberine and fisetin. You can use, according to the Mayo Clinic protocol, you can use fisetin. Accumulation of senescent cells is a fundamental aging process which compromises health span and shorten lifespan. Okay, this mind. Okay, so you have to remove or suppress the senescent cells to live longer. Reduction in senescent cell burden can be accomplished by using senolytics and xenomorphic. Okay, this is again, this is what I'm talking about. You can slow down your aging if you do everything right. So, propose personal protocol for health span and cancer prevention. I propose a multi-phased lifestyle and supplementation strategy to reduce senescent cell burden and cancer risk. This is presented as a personal protocol, not medical advice. Again, this is just my opinion, but what I recommend. Dietary foundation, adopting a low-carbohydrate carnivore-style diet to reduce intestinal permeability. Okay, this I was talking a lot about this, so like using a carnivore diet, a modified carnivore diet with mega doses of ascorbic acid and also with resistant starch together. And then it is reducing systemic inflammation and toxin load from plant-based foods. Okay, dietary change is absolutely necessary, but mind that even 6 months is not enough to get adopted to this carnivore-style diet. You need maybe longer, so I recommend to do it slowly. And prebiotics such as resistant starch may reduce fermentation of undigested protein by pathogens in the colon and improve gut health. This is why I recommend modified carnivore diet. This with prebiotics, especially resistant starch like potato starch together with ascorbic acid, and then it will work. So again, I give reference to the scientific publications, but I use it a little bit more. Different prebiotics together with large doses of ascorbic acid. Okay, what else? What you can eat on carnivore diet? Or any animal products, especially high quality eggs and the fatty meat and milk and dairy products. But you have to avoid fruits, vegetables, and grains. Any food which is produced from beans, nuts, fruits, and vegetables are not accepted. Yeah. But again, mind that a strict carnivore diet is not for longevity. It is maybe for health, to suppress autoimmune diseases, autoimmune reactions of your body in younger age, but in older age you have to adjust it a little bit, to modify it so that it will work also to extend your lifespan. Okay, I was talking about this a lot. So glucose management. Use berberine to lower blood glucose level, potentially slowing metabolism in senescent cells that rely heavily on glucose. You can go to the source of information. And mind that metformin is not recommended because it is actually, it helps in some cases, but on the carnivore diet it is not so good. So berberine is perfect. I highly recommend you. So synesthetic support, regular intake of natural synesthetics like quercetin, fisetin to suppress SASP. Yeah, highly recommended. Quercetin, both, and fisetin especially. Metabolic stressors, high intensity interval training and breathing exercises to create short-term increase in reactive oxygen spaces, which may selectively stress vulnerable senescent cells and cancer cells. This again, I use cycling, and cycling, like, you know, high intensity interval training. So for a while, you go above your limit of your oxidative ability. So you go so that you don't have enough oxygen in the blood. So you reduce concentration of oxygen in the blood, and then it creates a stress in all your body, and also senescence and cancer cells produce more, and all your body is shifting to glucose as a source of energy. So what is happening? Why it is working? So when you go to high intensity interval training, then concentration of glucose in your blood is dropping for a while, dropping a lot. And as senescent and cancer cells depend on glucose, even short change in the concentration of glucose in the blood can suppress the growth and metabolism in hyperactive cells, and eventually even can go to apoptosis of this cell. So it is very, very recommended. But again, what else? This pH, and it is like acidity in digestion. Intake of citric acid and other Krebs cycle acids during and after meals helps protein digestion and improves gut flora. Okay, citric acid and other like other Krebs cycle acid, they improve digestion. So highly recommended. And like lemon juice, yeah, okay, whatever. Malic acid also works perfect. Metabolic cofactors, supplementation with vitamins B, B3, B5, B12, choline, and betaine to support methylation, energy production from fats, and detoxification pathways. It's very also beneficial. Choline you can get from eggs. Betaine is relatively cheap. You can buy it. It is a subproduct of sugar production. And hormonal and sleep support. Use niacin, vitamin B3, melatonin, magnesium salt, theanine, tryptophan, GABA, glycine to support immune function, hormone production, and restorative sleep. I sleep normally 8 up to 9 hours a day, and the niacin helps to fall asleep, and melatonin, if you can buy melatonin in doses like above 2 grams a day. Magnesium salt and magnesium chloride is the best, and the other essential amino acids also recommended. GABA can be produced from glycine and taurine, so okay, but you can take as supplements, no problem. So, okay, what you have to do, you have to produce serotonin and melatonin, and this serotonin and melatonin is produced from tryptophan, but also you can use, but also, okay, you see that protein is absolutely necessary to produce melatonin. Okay, so you can use this slide to understand what to take. Okay. So what is else? Periodic senolytic interventions. Short-term periodic use of senolytic compounds like fisetin protocols. It is Maya Clinic protocol. Pardon. is considered crucial for radical rejuvenation and cancer prevention. Okay, you can read publications. I use Fisetin supplements daily in small doses and a little bit larger doses also once in 2 months, every 2 months for 1 day. So, and the mega doses of ascorbic acid long-term intake of vitamin C in mega doses can be used both for control of senescent cells and as also as mild laxative to shorten the gut transit time and avoid production of toxins by pathogens in the colon from undigested collagen. And what else? Regular use of sauna, cold shower, meditation, stress management also helps to sleep better and to recover. And also it is good for your health. Okay, Fisetin. Fisetin, you can read about this. Fisetin is, according to the Mayo Clinic protocol, is reducing the number of senescent cells much better than other supplements. So you can see here at this slide, you see number of senescent cells dropped much more than with other, with curcumin or with other supplements. So it is recommended. So, and mega doses of vitamin C. Oral mega doses of vitamin C are not effectively absorbed, and high oral doses can cause side effects like osmotic diarrhea. I consider it is not a problem, so you are cleaning your gut. If you take it in the morning, your gut will be, all these toxic products will be like not digested protein will be removed from your gut. So, and it was also acidity in your colon is stimulate peristalsis. So it is time of the food or this gut transit time is getting shorter. So it is very, very helpful for gut health, but together with resistant starch. So only 50% of ascorbic acid are absorbed. If the doses are higher than 1 gram or 1 gram, it actually, and what is above 2 grams is considered mega doses. Oral dose administration of mega doses every hour cannot raise blood concentration about some necessary level to kill senescent cells. So only this intravenous infusion of sodium ascorbate to your blood can kill senescent cells sufficiently. I didn't try it, okay, but again, please mind that you have to first to get adapted to this, and maybe you can try to once a year, I don't know, these intravenous injections of vitamin C. So, conclusion, by targeting the common root of cellular senescence through this combined approach, it is like reducing inflammation, supporting metabolic health, and periodically clearing senescent cells, it is possible simultaneously to slow aging and reduce risk of malignant tumors. So again, I recommend you to prevent and don't try to use to go to doctor to make scanning for your cancer cells. It is autopsy is, I mean, it can be dangerous sometimes. So it's because this Röntgen and other method to find out what tissues are cancerous can actually ignite the tumor's growth, so, and the metastasis. So be careful. Again, here, the source of information, make your own research and decide what to do, because I always rely on scientific publications, not on the opinion of people. So I also have my personal opinion. I use it for myself. So, but I cannot take responsibility for you. So if you decide to go other way, it is up to you. Okay, so thank you for watching the video. I share this my personal opinion, and my opinion mostly is different from official recommendations, because I don't go to doctors. 25 years I stopped going to medical professionals. 25 years. I made the mistake a year ago to accept the vaccine, not COVID vaccine, but tetanus vaccine, and consequence were terrible. So it was the consequence was a sharp increase in inflammation and sharp increase in aging of my cardiovascular system. And after a year, little bit longer, 14 months after this vaccine, I am recovering, but not yet completely. So my pulse pressure was, before this vaccine, was in the range of 34, 36 millimeters of mercury. Now it is 42, but after the vaccine, next week it jumped to 50, 55. So it is a lot of, it can be used for estimate aging and cardiovascular system age, better than any other methods to estimate age. So again, please mind that again, I would not recommend you. So if you will do everything right, you will be healthy at all. So 25 years, I don't take any advice of medical professionals. Okay, this vaccine was my big mistake. So I'm recovering from this. But again, I don't have even common cold. Nothing, absolutely nothing. And even people, if I stay with infected people and they're sneezing and coughing on me, nothing. Mega doses of ascorbic acid help me stay healthy. Okay, so don't forget to press like and bell button, subscribe to my channel, share this video with your friends and family. My clients, they report quite good health improvement, even in short term, like 2 months. Sometimes they can improve health only in 2 months. And they're very enthusiastic about what I propose. But unfortunately, I cannot find financial support for clinical trials, so that I do this, I rely myself on my own recommendations, but I cannot present them as official recommendations because I need clinical trials, and clinical trials are expensive. I cannot afford it, and also it is strange that even if I don't ask much money, but again, mostly it is permission to make clinical trials, but I didn't get it. Okay, didn't get it. Okay, have a wonderful day. Ciao, ciao.